In the next stage of therapy, there are two major shifts. The first one being that the patient begins to be their own therapist. Until now, the therapist has used Socratic questioning to guide patients through the process. In this stage, the role of the therapist changes to one of being more consultative and supportive and puts the patient in the driver's seat of challenging their own distorted beliefs or stuck points. The second shift is from assimilation to over-accommodation. But how does this shift happen? Well, over-accommodated beliefs develop in an attempt to feel safer. The patient will adopt these attitudes in order to feel safe and away from danger. But as a result, it also isolates them from other people and keeps them remaining fearful. If we move on to the technique, we continue to use the challenging questions worksheets. And patients, in trying to do this on their own, often find it quite difficult to challenge their own stuck points. Here are two tips that you can use to help patients filter their questions to identify stuck points. Ask the patients to consider, would this evidence hold up in court, as well as, would others observe and agree upon that evidence? The next therapeutic technique involves using patterns of problematic thinking worksheets. Again, have a look at our handout for one of those. Here are a few examples from the Patterns of Problematic Thinking worksheet. In addition, there is overgeneralizing, mind reading, and emotional reasoning. And just to give an example of emotional reasoning, it would involve with starting to have a feeling, so thinking there must be a reason for it, and then as a result feeling guilty, believing that one must have done something wrong.